Joining us now at the N-Form Petroleum Safety Conference taking place in Banff is Brett Webb. And Brett, you are with the Health and Safety Public Services Association in Ontario.
Correct.
Okay, now what was the purpose of your talk here today?
So the idea was to look at health and safety culture as a catalyst for change and how it can then impact other business outcomes, so efficiency or quality, etc., but to use it as that catalyst as opposed to an add-on to a program that you may or may not have.
Well, one of the references you made is that some people just don't see health and safety as important in a company.
Yeah, I mean, I look at it. I've spoken to a few people and done a few surveys over time, and it's always interesting when you speak to a CEO or a manager. You say, do you care about your employees? And they said, yeah, of course. But it's the gap between that comment and what they actually do. That's the piece that is interesting. And you know what, I've come to some conclusions through some of the work I've done. It's a few things. One, they think everything's great and there is no room for movement, or they don't know how to do it. Like they know how to create a strategic priority or a strategic plan around production, but they may not know what a strategic plan around health and safety is. And there's another one I'd like to chime in there, which is illusionary superiority, which is, I'm doing a great job at this. And the inability to see the gaps in their leadership style, or even the gaps in how to move forward from a health and safety perspective.
So what are the consequences of these ideas then when it comes to management and leaders?
Well, not only from a health and safety perspective in the way of cost and lagging indicators from injuries to to fatalities, but also I think it impacts greatly on engagement and the willingness of staff to get behind something in an organization, and ultimately the general organizational culture is affected. Not just the health and safety culture, but the actual culture of the organization, which is then going to impact on profit margins, on your ability to stay in business, and that leadership component and how they use their emotional intelligence in relation to health and safety is a big difference on how they can create effectiveness.
You also use the term perception a lot.
Yep.
And that new workers have different perceptions when it comes to health and safety as opposed to the older workers.
Yep.
Tell us the difference between the two.
So through some of the research we did, we saw that new workers generally, so people under the age of 25, so young workers, had a more positive perception around health and safety, but there was two components. So involvement was much lower, which goes in line with the the research on millennials. The need to feel a part of a team, the need to be involved, which is great because now it provides you insight in how to make a difference. How now I can have some science behind, or some more informed about the perceptions of that group, to be able to say, well, now I can create initiatives around that change. Now I can actually make a difference in their perceptions, to get buy-in, to build experiences, and that's what young workers, from a health and safety perspective, it's that lack of experience, and they can gain that through involving them in policies and procedures, through involving them in the risk assessment process.
Now, and then when it comes to the older generation, the older workers who've been around for a long time, what is their perception when it comes to health and safety?
So yeah, we could look at this from different perspectives. So that's when we start to get into complacency. That's when we start to get into their perceptions around risk, right? So their perceptions around risk can be affected through, I'm doing this job for 20, 30 years. This is the way it's always been done. So the opportunity for change, the opportunity to be able to overcome that perception is somewhat reduced. But knowing where it lies is the start to make those inroads into changing it. And it does come through an effective leadership group.
Another thing you mentioned too is recognition. We're going back to the millennials and how they need to be recognized for doing health and safety properly. When you mentioned that, I thought, oh, come on. Is that real? I'm 55, so of course I would think that, right? Because my whole thing was you were recognized by not having anybody say anything to you. That's when you knew you were doing a good job. But it's different now. And if the people of my generation are the leaders, there really has to be some sort of adjustment here.
Yeah, it's actually, there's a lot of research around engagement and, a participatory approach, as I said in the presentation. There's a lot of research about how that affects business outcomes generally. There's not a lot of research on how it affects safety outcomes and then how that then can affect business outcomes, but there's a lot of research on it. What there's not a lot of research is how the perception of the older generation then interacts with that younger generation, or even a commitment to understand the younger generation, because that's the workforce, that's the future of the workforce, especially through the retirement of the baby boomers. You have to be able to know how they operate, why they operate, how they do stuff, how it impacts on safety, to be able to really make inroads into creating a positive culture.
We'll finish up with, I have not heard anybody use these terms in a conference before. Use the term dork. You quoted Stalin,
Yes.
And you also mentioned monkeys. So let's go through one of them at a time, and we can wrap up with this.
I can't remember the dork one.
Oh, the dork one. The dork was, you don't want to be the dork when it comes to safety culture.
Yes, so the idea behind it was, that if I come, especially young workers or new workers, if I come to a job site and, the behavior is, let's say, to not tie off, I don't want to tie off because now I'm the dork of the crew. I'm the one stepping out of the norm to be able to comply with maybe the training I just received, right? So I need to affect the perceptions of those people and their behavior of the entire crew. So i.e. to create a more positive culture across the board, to be able to make inroads into creating a safer environment for younger and vulnerable workers.
So it's okay to be a dork in this situation.
Absolutely. Yeah, it's encouraged.
Okay. Stalin.
So the quote from Stalin is, the death of one man is a tragedy, the death of a million is a statistic. So the idea of this is to get away from lagging indicators, to get away from looking at lost time injuries, to get away at looking at fatalities as a cultural change initiative. We need to look at how we can get the human aspect back into it. We do health and safety because we care. We want to make a difference. Now, the other dorky part is the actual perception of a health and safety professional, right? I'm here to make trouble. I'm here to be annoying, as opposed to I'm here to make a difference. I'm here to save lives, both physically and mentally, from a direct perspective and indirect perspective, from a family component.